Abnormal uterine bleeding probably affects somewhere between 25 to 30% of women at some point in their lifetime. It can be manifested as bleeding that's very heavy during regular cycles, and that is loosely defined, but basically bleeding that's probably more than 5 to 7 days of significant bleeding. Bleeding that causes anemia, either symptomatic with being pale, lightheaded, dizzy, during the time of your menstrual period and ongoing, or anemia on blood draw. Also, just if it affects your quality of life. A lot of women that have abnormal heavy bleeding or menorrhagia will be afraid to go out of the house during the time of their menstrual period because they're afraid that they might, leak on their pants, or they feel so terrible, or that would be what I would say the majority of women that have abnormal uterine bleeding present as is heavy bleeding with regular cycles. Some women complain of mid-cycle spotting or prolonged periods, maybe lasting greater than a week or 2 weeks or more, continuous bleeding in some cases. Women that are postmenopausal that begin to have bleeding after they've ceased their regular menstrual periods for over a year and then begin to bleed again for various reasons would be considered to be having abnormal uterine bleeding. It's important that a woman that is experiencing abnormal bleeding see her doctor, have a thorough investigation of the problem, and then once it's been determined what the problem is, we can arrive at potential treatment options, and there may not be a specific source or reason why a woman's having abnormal bleeding, but even in that case there still are both medical and surgical treatment options that are available to help women with abnormal bleeding.